2.5 million Americans have AFib, a form of heart disease that can lead to blood clots, stroke, and heart failure. But there are treatment options. Joining me now to discuss is Dr. Charles Pollack, professor of emergency medicine at Sidney Kimmel Medical College at Thomas Jefferson University. Dr. Pollack, thanks for joining us today.
My pleasure, Robin. Thanks for having me.
So let's start with kind of a basic question. And why is diagnosing and treating AFib so important?
Well, it's important to recognize that you have AFib because once you're in it, your risk of having a stroke goes up significantly. Patients with AFib are 5 times more likely than patients without AFib to have a stroke. And those with AFib who do have a stroke are more likely to have debilitating or even fatal strokes. So it's really important to recognize it and start management of stroke risk as early as possible.
And you say there's a heart-brain connection when it comes to AFib. So why should those who already are diagnosed with it talk to their doctors about that part?
Well, the heart-brain connection is the fact that something abnormal going on in the heart can actually contribute to stroke in the brain. So it's a nice way to think about sort of a total body health issue. Patients with atrial fibrillation have an abnormal activity in the atria, which are the top smaller chambers of the heart. And that has a couple of implications. One, they don't beat regularly, which means the ventricles, the large chambers at the bottom of the heart that pump blood out to the body, don't beat in a regular fashion, and that can create symptoms for patients like palpitations or chest pain or dizziness or anxiety. The second implication is that because the atria are not beating in a coordinated fashion, they're sort of quivering, blood clots can form in the atria, and those blood clots can eventually be pushed into the ventricles and then pushed out to the body. They can go in lots of different directions, but the ones we worry about the most are the ones that go north to the brain because those are the ones who cause stroke. So by reducing the risk of those blood clots forming in patients with atrial fibrillation, we reduce their risk of stroke.
Yeah, so are there any tips in something that patients can do for themselves to kind of reduce that risk, or is it just, a situation where they have to talk to their doctor? Well,
the risk of developing AFib for patients who don't have it can be reduced to some extent just by following a heart healthy lifestyle. And this is Heart Health Month, so it's good to talk about that. Regular exercise. If you have high blood pressure, good control. If you have diabetes, good control. Good nutrition, exercise regularly, don't smoke. These are all important things that may reduce your risk of atrial fibrillation. But if you do have it, then the only way we have of reducing stroke risk in those patients is to thin the blood out a bit, give drugs that we call anticoagulants. And that will reduce the likelihood of these abnormal clots forming, which in turn will reduce the likelihood of stroke.
Now, are there risks and benefits associated with that treatment?
There are. Anticoagulants interfere with normal blood clotting. And so you can't give an anticoagulant, whether it's warfarin, which we use for many decades, or one of the newer agents like dabigatran, Pradaxa, that's been approved by the FDA in the last 4 or 5 years. By definition, a drug that thins out the blood is going to increase the risk of bleeding. Spontaneous bleeding as well as bleeding after you cut yourself or in an accident or a fall. So for each individual patient, and this is again, Robin, why it's so important that physicians and patients talk to each other about this. For each individual patient, you have to calculate what we call a risk-benefit equation. We know that giving an anticoagulant will increase the patient's risk of bleeding. What we want to assure ourselves of is that by giving that anticoagulant, we give enough reduction in stroke risk so that it outweighs the risk of bleeding. In most patients, that is the case.
All right, as you mentioned, Doctor, it is Heart Health Month, so we want everybody to be aware of these possibilities. So I want to thank you so much for being with us.
My pleasure, thanks.